Stereotactic guided breast biopsy is designed to calculate the exact location of the breast abnormality. Calcifications and masses are examples of the types of abnormalities that can be biopsied using stereotactic guidance. The Suros ATEC Pearl and ATEC Sapphire breast biopsy systems are compatible with all major prone and upright stereotactic systems. In this presentation, we'll be featuring the ATEC Sapphire breast biopsy system with the Hologic Multicare Platinum Prone Stereotactic Biopsy Table with the Eviva breast biopsy device. Diverse needle options are available to address all of your patient's needs, regardless of lesion location or breast tissue. The Eviva family of products offers 9 and 12 gauge biopsy device options that are best suited for stereotactic breast biopsy, as well as petite options for thin breasts, allowing treatment of a broad patient spectrum. Once the patient is ready, position her on the stereotactic table and compress the breast. The technologist selects the image acquisition mode and X-ray technique that is appropriate for the lesion and breast composition. A scout film and pair of stereo images are taken. Enhancement tools and filters allow image manipulation to improve contrast and sharpness and to help ensure accurate positioning and localization of the area of interest. The technologist initiates one or more stereotactic targeting sequences. A Cartesian coordinate system determines the precise position of the lesion in the X, Y, and Z planes. The area of interest is then targeted by the technologist or radiologist by marking the lesion location in both views of the stereo pair. Once targeting is complete, coordinates indicating biopsy needle position relative to target position for up to 6 targets are transmitted to the display window on the stereotactic table. Cleanse the skin surface thoroughly with an antiseptic solution. At this time, a syringe containing additional anesthetic can be attached to the Y valve. This permits additional anesthetic to be pulled into the biopsy cavity during each cutting cycle. The disposable needle guide is placed in the needle guide holder on the adapter using aseptic technique. With the Z dialed to the most negative position, the Eviva stereotactic adapter is secured to the top of the stage and tightened in place by turning the wheel. Check to make sure the adapter is secure, not tilted. Once the adapter is secure, raise the stage to biopsy-ready height. Turn the console on if you powered down after test and setup. Remove the protective sheath from the biopsy device and assemble the introducer onto the device, leaving the protective sheath on the introducer. Before putting the device on the adapter, remove the sheath from the introducer and confirm the device is in the pre-fire position with the white button on the firing mechanism fully depressed. The Eviva device is placed into the adapter, sliding the needle through the needle guide and locked into place at both the front and back of the adapter. Check the security of the device by gently pulling back on the device. The Eviva device is then Z0 to the reference point on the compression paddle with the Multicare Platinum table. The needle must be backed away from the breast before initiating the automatic targeting sequence. Activate the automatic targeting system, motor enable and target position, to move the device to the identified X and Y coordinates. Using the manual Z dial located at the back of the stage, move the Eviva device with the needle tip to the skin surface of the breast to ensure accurate anesthetic placement. To increase patient comfort during the biopsy, an anesthetic is injected to numb the skin surface at the area of interest. Deeper tissue will then be anesthetized by injecting deep to the target site. The tip of the biopsy needle will extend beyond the target site, so it is essential to administer anesthetic beyond this point. Remember, if a syringe of pain medication has been attached to the Y valve, this pain medication delivery system will assist with patient comfort as well. A skin nick is made by a surgical blade to allow easier entry prior to advancing the needle to the biopsy site. Manually advance the needle into the breast until the Z column of the differential line reads -5. Before firing the Eviva device, take a pair of pre-fire stereo images to determine that the area of interest is correctly targeted. activate the view stage cursors to ensure that the injection of anesthetic has not caused any lesion movement. The device is then fired by fully depressing the green button on the remote firing mechanism, advancing the needle 23 millimeters. The technologist takes a pair of post-fire images to ensure the center of the aperture is at the area of interest. Cores can be taken at any clock position at the discretion of the physician and depending on the location of the area of interest by rotating the rear thumb wheel. The position of the aperture opening, or clock position, is indicated by numbers located on the middle section of the device.
How are you doing?
An audible beep indicates you are at the end of a cutting cycle and it is safe to turn the device to the next clock position. To prepare for this procedure, the physician places his or her hand on the thumb wheel at the rear of the device. The physician depresses the foot pedal to activate the biopsy system and continues to depress the foot pedal throughout the tissue acquisition sequence. Tissue acquisition occurs every 4.5 seconds. The manual rotation of the device occurs during the resting phase of the 4.5-second cycle, just after the audible beep. When the necessary core samples have been retrieved, release the foot pedal and switch the console to lavage mode by pushing the button marked lavage. Lavage mode delivers saline and aspirates the biopsy cavity, allowing loose tissue and other fluids to be cleansed from the site. Lavage the cavity 360 degrees until the fluid in the collection chamber indicates the cavity is clear. End the lavage rotation with the aperture in the 6 o'clock position. To retrieve the sample cores, leave the console in lavage mode and disconnect the saline line at the proximal end of the Y valve. Disconnect the saline line by removing the yellow connector located down the tubing near the anesthetic automated delivery system. Return the console to biopsy mode. The cores are now ready to be retrieved from the tissue collection chamber at the back of the device. Rotate the collection chamber counterclockwise to disengage the container. Remove the tissue filter basket and place a new tissue filter basket in the collection chamber. Place the chamber back onto the device and then reconnect the saline line. Using your fingers, grasp the thin metal wire at the top and around the tissue filter basket. To avoid losing any samples, before pulling up on the wire, tilt the tissue filter basket toward the specimen collection dish. Use the wire spatula or forceps to separate the tissue samples on the prepared surface to be imaged. Take the specimens to be imaged. When you have verification that the samples have been successfully retrieved, you may remove the device from the adapter by lifting up on the back latch and sliding the device back, leaving the introducer in the breast. You are ready to begin marking the biopsy site by placing a biopsy site identifier in the biopsy cavity. For this demonstration, we will be using the Secure Mark for Eviva biopsy site marker. Insert the Secure Mark for Eviva deployment device into the introducer. The deployment device will lock into the introducer. Deploy the marker by fully depressing the plunger until it locks. A final 0-degree image is recommended to compare your post-procedure outcome to your initial scout image from the beginning of the procedure. After confirmation, remove the introducer marker assembly from the adapter by pinching the tabs to release it from the adapter. Decompress the breast by slowly releasing compression paddles and cradling the breast. Immediately apply pressure to the biopsy site. When pressure is no longer needed, apply a steri-strip or other bandage to the biopsy site. Help the patient to an upright position and discuss post-biopsy care. Appropriately dispose of all used product, such as device, marker, deployment device, canister, etc.